Is that fine? Are you ready for that? Are you still awake? Good. Would you like to say something in this? Or? Okay. So then I will probably give the floor to myself. And what I will be discussing with you is indeed the helicopter view on the AMR situation as we have observed it. So, first of all, just one notion how we work with the non-EU countries at ECDC. This is from the ECDC International Relations Framework. And there our first strategic objective is to prepare the EU pre-accession countries for participation in ECDC activities. So that's from our policy 2020. And I have now looked the activities and the situation and the development or the evolution since 2012, since the Dubrovnik meeting. And on the right side of the first slide, you can see some of the key achievements we have, I could say, and some of them we will come back later. So, as you know, we work through national correspondence. We meet regularly, and for us, the network of national correspondents is our a sounding board for all strategic decisions. There has been almost 1,000 participants attended our technical meetings, and last year a little less than 100. We have also integrated experts from the countries to EPCs, so the food and waterborne, and travel-associated Legionella. You have been able to report some selected diseases to TESI, and I hope and trust that we will also be in better position to provide you feedback on the reported data. You are observers in the focal points for microbiology, preparedness, threat detection, and surveillance. And just yesterday, you all received the results of your second round of EN LabGap. So we have the EU LabGap, where EU countries can assess their capabilities and capacities in the laboratory, and we have that also for you, and I will come back to that later. And then one big important part of our work is what we do on the request of the Commission, and they are the assessments we have been running. And those are almost done. And of course, for those who were done already some years ago, we are following up how the countries are implementing their action plans. And we have some other microbiologic projects where countries can participate. But this is where we started from. And this is the group picture of the Dubrovnik meeting. Can you find yourselves? Yeah, I think many of you can. And you can also see what were the objectives of that meeting. And so in that meeting, we really wanted to have an understanding what you to have an understanding what we do at ECDC, but also then we to have an understanding how you could participate in the EU surveillance networks, which were presented earlier this morning. And of course, as always, when we come together, we try to exchange experiences, and so we did also in this meeting. You don't have to look this big, you can't read it, but I will tell you what were the main findings when we did the mapping of your situation. So basically, the Western Balkan countries, so you were on very different levels in order to, as regards the implementation of EU acquis on AMR, and also ECDC requirements for joining the surveillance networks. At 2012, I don't know why that is so difficult for me, to develop national legislative frameworks, action plans, as well as surveillance systems. And then there were different types of barriers for going forward. And if you look of that, in all of them, one of the aspects is the non-sustainability due to the lack of either financing or human resources. But if we then look what has happened after that. So we heard Danilo telling us what they have been, what WHO has been doing in support to countries to strengthen the national AMR surveillance. And ECDC, we have been working with you since that. So there has been several technical meetings on AMR and hospital-acquired infections. And you see that more than 80 experts participated in those. There were a couple of countries have done their attempt on the point prevalence survey. I talked already about the EN LabCap survey, and I think that there now 2 countries are on the intermediate level. And there is also a possibility for EQAs. And then, as I said, the assessments cover also antimicrobial resistance and healthcare-associated infections, but it covers also other areas. So it is really comprehensive system-based assessment. It looks the communicable disease prevention and control system as a whole. And based on these assessments, I would say that there are still common needs. And I think the commonalities are still either to develop or to reinforce the high-level national strategies. There are strategies, but they are not implemented due to the lack of resources. Also, there is a need to define and further strengthen functional systems for surveillance. And when it comes to the functional systems, so there it's the microbiology laboratories. I think there the focus should be, as well as then the EU standards. And the intersectorial coordination mechanism, I think we will hear the reality, but in many countries, based on the assessments, we are not, the operationalization and the outputs from this mechanism is to be seen. So this is something about the EN lab gap, and there just for some points for regional attention, you have your own results, and there I think it's the clinical practice and improve utilization of diagnostic testing for Clostridium difficile, for example, those which is deserves some attention, as well as they are the AST for gonorrhea, and then the cross-sectoral monitoring of AMR. And in fact, here you see the map of the EN lab gap with 2017 data. And in fact, there are 2 countries in intermediate level, I think North Macedonia, as well as Serbia. And I would also like to draw your attention to a joint effort we have done at ECDC with International Relations section, together with Microbiology section, together with the observers on the microbiology focal points in your countries. And I think it's a great achievement. It's the article in Frontiers, just came out a few weeks ago, on investing in public health microbiology laboratories in Western Balkan countries enhances health security from communicable diseases threats in Europe. And I think if you read that, it tells a lot what we should be thinking. So this is based on the results of the OHRID meeting where public health microbiology was discussed, those results. And you see the main messages also that, and I think this just confirms what I have heard many times today from several speakers, the importance of laboratories supporting public health in any surveillance, including surveillance of antimicrobial resistance. And therefore, we have now focused very much on surveillance and microbiology laboratories. But I should also remind you that, of course, the laboratory work is not only for public health, it's also for patients, and the information is also to treat patients, and that's also important. We collected in advance of this meeting also the initiatives from your countries as regards any activities you have on AMR, and whether they are on human side, on animal side, or whether they are under One Health. And in this you see that if you look all of them, there are fair number of initiatives. They are relatively small, and most of them are on human health. If you break it down and leave only those which are either not started or are ingoing, they are a bit less. There is quite a little money involved, but they are more on combined human and animal health. And there are no really comprehensive activities under One Health umbrella ongoing in the region. The one mentioned is a national action plan, which still needs to be implemented, and that's the only one. So if I would conclude from this overview, what are the commonalities or what are the findings? What would be, as a doctor, what would be my diagnosis of the situation? I would say that since 2012, countries have made certain progress, and we have heard about this progress, and we will hear much more today when we go around the posters. And countries are also at different level of advancement, and I think that's normal. There are still missing elements for effective AMR responses across sectors at strategic, system and operational level. And at strategic level, I would say that the One Health framework is still missing, strategies with goals and indicators are missing. At the system level, I would say that the surveillance systems and laboratories supporting public health needs a lot of attention. And at operational level, I would say that the existing data should be used for action, and that we have also said. And sustainability, including the personnel in public health, is an issue. And I, in fact, have heard also some of you indicating that also to me today. So with this, I think it's time to finish the web streaming, as we will be now taking our action part. So I thank all of those who have been with us via web. I hope you have enjoyed, and I hope also that the excitement we have had here, you have got a part of it. And we will start our country poster session from Kosovo. Thank you. So, it's time to stand up, stretch, have a look that you have good shoes, and I will ask the representative from Kosovo to go in front of the poster, and then I think it would be probably good if we would move away from tables and come near Professor Raka. Okay. I don't. So please move. You will get, whoever will present will get a microphone. And then the others, please come nearer so that you can hear and listen, and then the journey starts.
Thank you. Thank you very much. Okay, then we are the first one to start, and I have how many minutes?
Maximum 10, but I would prefer that you would 7.
7, okay, no problem. Then One Health against AMR in the Western Balkans, Kosovo. Kosovo was the last country to join ECDC program on AMR and healthcare-associated infections in London meeting 10 years ago. It was 2009. But we were the first country in region to do homework. 2 years later, we prepared a national strategy and action plan on antimicrobial resistance, and it was on the April 7th, the WHO day, and that year was also AMR topic of So it was 5-year action plan without any support from government, €0 budget. At the end of 5th year, we accomplished our 35 activities, 80%. How we did that? We didn't complain about the budget because Kosovo has the lowest governmental